Preoperative oral thyroid hormone therapy prevents the risk of Euthyroid Sick Syndrome. After cardiopulmonary bypass, most pediatric patients show a decrease in the level of thyroid hormones. This increases the risk of developing postoperative Euthyroid Sick Syndrome and myocardial ischemia-reperfusion injury, which are the major reasons of morbidity and mortality after cardiopulmonary bypass. A study demonstrated that thyroid hormones infused during the postoperative period is beneficial to infants and children, but intravenous infusion can cause accidental overdose, leading to increased arrhythmias and sudden death. However, preoperative oral administration of thyroid hormones is indicated to prevent the incidence of Euthyroid Sick Syndrome. The aim of the trial was to determine the efficacy of oral thyroid hormone therapy in reducing the risk of Euthyroid Sick Syndrome and myocardial ischemia-reperfusion injury in pediatric patients who underwent cardiopulmonary bypass. Pediatric patients, aged between 3 to 12 years, scheduled for elective congenital heart disease repair surgery with cardiopulmonary bypass under general anesthesia were included in the study. Patients having a history of radiation therapy, abnormal baseline thyroid function, thyroid and other endocrine diseases, serum creatinine levels greater than 2 mg per deciliter, and patients using preoperative thyroid hormone therapy and inotropic drugs were excluded from the study. The double-blind, prospective, and randomized placebo-controlled pilot trial included 40 children. The subjects were divided into two groups. The trial group received thyroid tablet 0.4 micro per kilogram orally, once a day for 4 days prior to the surgery, and the control group received placebo. Serum T3 levels were decreased in both the trial and control group after surgery. Serum T4 levels in trial group were increased after the surgery, whereas significant reduction was seen in the control group after the surgery. Serum TSH levels were decreased in both trial and control group during first and second day after the surgery, but were increased on the fourth day. In the trial group, the mean myosin heavy chain alpha expression increased, and the mean myosin heavy chain beta expression decreased after the surgery, compared to the control group. The study concludes that low dose of thyroid tablet was effective in reducing the severity of postoperative Euthyroid Sick Syndrome, and exhibits cardioprotective properties in postoperative pediatric patients.